I want to explain the state of the understanding in science about breast cancer and cancer in general. We have a genetic material called a suppressor gene, which suppresses the expression of cancer cells. Meaning, if that suppressor gene is active, your body will not allow cancer cells to multiply and take over. We don't know why some people have more active suppressor genes than others. We don't know why some people become victims of breast cancer or any other cancer at earlier ages than others. We really need to research that suppressor gene. But what we do know is that there are some things, whether it be in diet, medication, radiation, environmental factors, that make that suppressor gene less effective or more effective. In the case of hormones, what we do know is that synthetic or horse's urine hormones or birth control pills or hormones that are not molecularly identical to the hormones your body makes somehow affect the suppressor gene to lower its function. What we do know is that your own body, with the aging process, the suppressor gene becomes less effective because as we get older, the incidence of breast cancer and cancers in general increases. So what we want to do is do things that we do know will enhance the action of the suppressor gene. So that's eating vegetables, cutting out the sugar, cutting out caffeine, the alcohol, the fats, taking care of ourselves, exercising, increases the production of hormones that improve the suppressor gene's activity. Taking hormones and bioidentical hormones protects you, improves suppressor gene activity if done correctly. I think that that's the most crucial thing, is to understand that any hormone you take may endanger you and may affect your suppressor gene, but if done correctly, you can use the hormones to enhance the production and the activity of the suppressor gene. So bioidentical hormones are safe, and they actually are less likely to induce you to get breast cancer than they are to decrease the incidence of breast cancer. As we get older, our own estrogen alone increases the risk of breast cancer. So if you don't have enough progesterone, which is why I recommend progesterone early on, I mean in your 30s and your 40s, before you go into menopause, before you lose all your hormones, because progesterone will protect from the negative effect of estrogens. Your own estrogens will increase your risk of cancer. So doing bioidentical hormones in the right combinations, with the right ratios, associated with the right diet, exercise, lifestyle, stress management, will decrease the incidence of breast cancer.